Dear viewers, today's discussion covers another important topic. That is, skin reflects one's overall health. Skin is the largest organ of the human body, filling in as a defensive hindrance between the inner organs and the outer climate. It is extraordinarily flexible, playing out various capabilities fundamental for our general well-being and prosperity. Human skin comprises of three principal layers: the epidermis, which goes about as a waterproof boundary, lodging melanocytes liable for skin tone; the dermis, wealthy in veins, sensitive spots, hair follicles, and sweat organs, offering underlying scaffolding and versatility; and the hypodermis, the most profound layer containing fat and connective tissue, managing internal heat level and padding inside organs against injury. Human skin shows different shades of variety, going from outstandingly light to dull, contingent upon variables like hereditary qualities, sun openness, and geological area. Moreover, skin surface and thickness can shift across different pieces of the body and among people. Understanding one's skin is essential for working on prosperity because of these reasons. Number 1. Health maintenance. Information about skin type, conditions, and potential issues empowers people to embrace proper skincare schedules. Forestalling or overseeing normal issues like skin inflammation, dryness, or sun harm. Number 2. Protection. Attention to skin's weaknesses engages people to go to proactive lengths to safeguard it from hurtful natural factors like ultraviolet radiation, contamination, and unforgiving synthetic substances. Executing sun insurance, utilizing proper skincare items, and pursuing great cleanliness routines are fundamental for keeping up with skin well-being and forestalling harm. Number 3. Psychological prosperity. Skin conditions can affect confidence and psychological well-being. Understanding one's skin and its necessities can assist people with feeling surer and in charge of their appearance. Number 4. Healthy maturing. Information about factors affecting skin maturing, like sun openness, way of life decisions, and skincare propensities, enables people to settle on informed choices to dial back the maturing system. This incorporates taking on a fair eating regimen, remaining hydrated, abstaining from smoking, and utilizing skincare items containing hostile to maturing fixings. Number 5. Overall body well-being. The state of the skin frequently reflects inward well-being. Certain skin issues might show hidden foundational conditions or nourishing lacks. Understanding these associations can provoke people to look for clinical counsel, prompting early analysis and management of potential medical conditions. Coming over the skin potentials. Human skin is a noteworthy organ with different potentials, fundamental for general well-being and prosperity. Potential. Number 1. Protection. The skin fills in as an imposing obstruction against outer dangers, including microbes, ultraviolet radiation, and actual wounds. Its furthest layer, the epidermis, goes about as a waterproof safeguard, keeping destructive substances from entering the body and holding fundamental liquids back from spilling out. This defensive capability is crucial for protecting inner organs and tissues, keeping up with well-being and prosperity. Potential. Number 2. Thermoregulation. Through components like perspiring and expansion or tightening of veins, the skin directs internal heat level, guaranteeing that it stays inside a limited reach, helpful for physiological cycles. By scattering heat through perspiring and monitoring heat through vasoconstriction, the skin keeps up with homeostasis, forestalling overheating or chilling, which could in some way or another trade off normal physical processes. Potential. Number 3. Sensation. Skin is luxuriously enriched with tangible receptors that empower the view of touch, tension, temperature, and torment. These sensations give urgent criticism about the outside climate, permitting people to answer properly to upgrades and keep away from mischief. Potential number for synthesis. The skin assumes an essential part in orchestrating vitamin D. When presented to bright ultraviolet radiation from daylight, vitamin D blend is fundamental for keeping up with calcium and phosphorus homeostasis, advancing bone well-being, and supporting safe capability. By delivering this imperative supplement, the skin adds to metabolic and physiological equilibrium in the body. Potential number 5 excretion. Sweat organs in the skin work with the discharge of side defects like water, electrolytes, urea, and alkali. Perspiring manages internal heat level, eliminates metabolic waste, and keeps up with electrolyte balance. Moreover, sebaceous organs discharge oils that grease up the skin and hair, forestalling drying out and safeguarding against microbial diseases. Further supporting the skin's job and excretory capabilities. Potential number 6 immune safeguard. The skin is outfitted with specific invulnerable cells and particles that structure the body's most memorable line of safeguard against microbes and unfamiliar substances. Epidermal dendritic cells and inhabitant-resistant cells. For example, macrophages and pulse cells effectively watch the skin for trespassers, starting safe reactions when important to kill dangers and forestall diseases. This insusceptible reconnaissance and safeguard component shields the body from outside attacks, adding to general well-being and flexibility. Anomalies and reasons. Number 1, dry skin, xerosis, often brought on by environmental causes, including low humidity, harsh soaps or cleansers, hot showers, or extended exposure to dry air. Dry skin appears rough, flaky, and occasionally itchy. Age, hormonal shifts, certain medical disorders like eczema, hypothyroidism, and drug side effects like retinoids, diuretics are additional significant variables. Dry. Dehydrated skin is caused by reduced moisture retention brought on by lipid barrier failure and inadequate hydration. To treat dry skin, one should moisturize the skin frequently. Stay away from harsh skincare products, use humidifiers, and take care of any underlying medical issues. Number 2, sunburn, when skin is overexposed to ultraviolet radiation from the sun or artificial sources like tanning beds. It can cause redness, discomfort, and even blistering. DNA and skin cells are harmed by UV radiation, which causes discomfort, swelling, and erythema are the hallmarks of an inflammatory reaction. Sun protection measures such as sunscreen and protective clothes are not worn by people with fair skin. And drugs that exacerbate light sensitivity are among the risk factors for sunburn. Avoiding peak sun hours, wearing protective clothes and accessories, looking for shade, and applying sunscreen are all part of prevention. Number 3, rashes. Rashes are skin appearance changes, including redness, lumps, blisters, or itching, and are often a sign of underlying infections, inflammatory disorders, or allergic reactions. Many conditions can cause rashes, such as atopic dermatitis, eczema, viral or fungal infections, autoimmune illnesses, heat rash malaria, contact dermatitis, e.g., exposure to irritants or allergens, and allergic reactions to drugs or foods. Noticing and avoiding triggers, maintaining proper hygiene, applying topical medications such as corticosteroids and antihistamines, and attending to the secret to effectively managing rashes is treating underlying problems. Number 4, bruising. Bruising is the result of blood leaking into the surrounding tissues from the burst of tiny blood vessels capillaries beneath the skin. Trauma or damage, such as bumping or smacking the skin, which causes localized coloring, swelling, and discomfort is a common cause of bruising. Individuals who are susceptible to bruising easily may also be affected by certain medical disorders and drugs that have an impact on blood coagulation or vascular integrity. Typically, treatment includes elevating the injured region, using cold compresses to minimize swelling, and giving the bruise enough time to heal naturally. To rule out underlying health conditions, a medical evaluation may be required in cases of severe bruising or frequent unexplained bruising. Number 5, skin lesions. Skin lesions are a wide range of abnormal growths, discolorations, or textural changes that affect the skin. They are frequently a sign of systemic diseases or different dermatological problems. The causes of skin lesions can range greatly and include inflammatory skin disorders, psoriasis, lichen planus, autoimmune diseases, lupus, scleroderma, benign growths, mosses, cysts, skin tags, infectious conditions, warts, herpes, fungal infections, and malignancies, skin cancer. The lesion's unique characteristics determine the diagnosis and course of treatment. Topical drugs, surgical excision, systemic therapies, and interventions aimed at underlying problems are among the options. Adequate corrective actions keeping your skin clean, moisturized, and shielded from ultraviolet radiation are all parts of proper skin care. For good skin health, it is also crucial to hydrate well, eat a balanced diet, abstain from smoking, and limit sun exposure. By using these doable corrective actions, you can improve skin health, ease frequent issues, and enhance general well-being. You can attain a glowing, healthy complexion and improve your self-esteem and general well-being by giving priority to skincare routines that nourish, shield, and preserve the skin's integrity. Apply moisturizing cream frequently. Applying a regular moisturizer to the skin helps it retain moisture and regain its natural protective layer, which lessens dryness, irritation, and itching. Using components like hyaluronic acid, glycerin, or ceramides to lock in moisture. Choose a moisturizer that is appropriate for your skin type and issues. To improve efficacy and absorption, apply moisturizer as soon as possible after taking a bath or shower while the skin is still damp. Your skincare regimen can be improved by including a regular moisturizing practice. That helps reduce dryness or irritation and encourages hydrated, healthy-looking skin. Put on sun protection. Avoiding sunburn, early aging, and skin cancer requires shielding the skin from damaging ultraviolet rays. Every day, especially on cloudy days or during the winter, apply broad spectrum sunscreen with an SPF of 30 or higher to all exposed skin areas. If you are swimming or perspiring, reapply sunscreen more than every 2 hours. In addition, avoid outdoor activities between 10 a.m. and 4 p.m. Seek shade and dress in protective clothes such as caps and long sleeves. Sun damage can be reduced, and skin health can be preserved by including sun protection measures into your regular routine. Use gently. Using a mild skincare regimen will help avoid rosacea, eczema, and acne flare-ups, as well as irritation and inflammation. To prevent the skin from being stripped of its natural oils and having the skin barrier disrupted, use gentle, fragrance-free cleansers. And refrain from using harsh scrubs or abrasive exfoliants. Instead of using a harsh cleanser, pat the face dry with a gentle towel. Avoid using components that are known to cause sensitivity or allergy, and substitute non-irritating skincare products. You can maximize the likelihood of positive reactions or reduced irritation by taking diligent care of your skin and utilizing mild skincare products. Keep yourself properly hydrated. Having healthy skin and general well-being depends on staying well hydrated. To maintain adequate hydration levels and encourage skin moisture from the inside out, drink a lot of water throughout the day. Reducing the number of drying drinks you drink, such as coffee and alcohol, can help prevent dry skin. To hydrate your skin from the inside out, include foods high in essential fatty acids, fruits, and vegetables in your diet. You may preserve elasticity, improve skin health, and lower your chance of developing dehydration-related skin problems by making drinking enough water a priority. Seek professional advice. For individualized assessment and treatment, consult a dermatologist or other healthcare provider. If you are experiencing severe or chronic skin concerns, a dermatologist can identify underlying skin disorders, suggest suitable skincare products or drugs, and create individualized treatment regimens to successfully address certain issues. Consulting a skincare professional can help you manage complex skincare challenges and achieve optimal skin health. Whether you are managing chronic skin diseases, addressing unexpected changes or anomalies, or looking for advice on skincare routines. To sum up, the intricate relationship between skin health and general well-being underscores the notion that skin serves as a mirror to internal health, offering valuable insights into an individual's physiological condition. By acknowledging the bidirectional nature of this relationship, the title emphasizes that maintaining healthy skin is not merely about aesthetics, but also about promoting overall health. It reminds us that caring for our skin involves addressing both external factors and internal health considerations. Therefore, by prioritizing skincare practices and addressing any skin abnormalities promptly, individuals can not only enhance their skin's appearance, but also safeguard their overall health and vitality. Here I come to the end of today's talk. You found this talk useful and informative. Do share it to your family and friends. Thanks. Take care.